Hi, Bio4, and welcome to part 2 of senses. And we were on the ear. We started out saying that this is the external ear, we have middle ear where these bones are, and then inner ear where the neurons actually are. So let's move on here. If you had to make a sort of stylized drawing of exactly that, what I just told you, this is what it would look like. You would have a region of the outer ear, and that region of the outer ear is just where the sound waves are coming in. And it would have some sort of drum, which is the tympanic membrane or your eardrum. So some sort of drum that these sound waves would sort of crash on there. And then you would have something in the middle ear that looked like this, you know, bone 1, bone 2, bone 3, so that when you hit upon this, this is going to move this joint and move this joint and amplify that sound. So it's going to make it a stronger mechanical movement of air, right? So that air is hitting here, and then this is going to amplify that. And then that amplification is going to push on the other end, and on the other end is fluid. So think of that. Air, amplification of it, of that movement, and then fluid. And that's what it's going to be. Okay? And there's this little membrane here. It's called a basilar membrane. And there's fluid above it and fluid below it. But if you were to push up here, it's going to create this indentation in there. And that indentation is going to affect the fluid that's in this compartment. It's going to hit this other area and create what we detect as sound. It's kind of complicated, but for now, just think of air, amplify, fluid. Okay, that's all I need you to think of. I want you to show you those little bones that really are not little metal pieces like here, but they're 3 bones, and they're called the malleus, this one, the incus, and the stapes. And see, they have these joints here that are going to be able to sort of flex and expand, and in that flexion and extension, they're going to increase the disturbance of air and increase sound. If you had to look at the size of these, they're remarkably tiny. They're the tiniest bones in your body. So here I compare it to a penny. Look, that's a penny. And look how very tiny these bones are. I love telling the story that one year I had a student that raised her hand and said, "I broke my malleus." It's like, what? How did you break this tiny little bone here, right? How did that happen? And it's she was water skiing, and she fell with her ear on the surface of the water, and then that jet of water is coming in at her ear, and let's make a little fracture on this, it fractured her malleus, incus, and stapes, because it looks like a stirrup. It got better all on its own, and she's fine, and she can hear. Okay, but let's start from the outside. Let's start from the external ear. The external ear is called the auricle or the pinna. Synonyms. Either one of those words is fine. Auricle or pinna. And that's where you're going to have the external auditory meatus, right? Remember you looked at that in the skull. And you're having sound waves that are coming in through that meatus, and they're hitting the tympanic membrane, right? And they tell you don't put that Q-tip all the way in there to the tympanic membrane because you could damage it. And you could just clog it up with wax. So let's move on to the middle ear. Well, that's located already in the temporal bone. And that's where those auditory muscles, ossicles are, and the malleus, incus, and the stapes. The order of those, the way I remember it, is spells miss. Miss. Malleus, incus, and stapes. And this region of the middle ear is connected to your throat by the Eustachian tube. So you have this tube that comes from the ear down into your throat. You know that, right? Because when you get a terrible cold and all of a sudden you have fluid everywhere, you have in your nose and your ears and your eyes are watery, you have fluid everywhere, and then you have this postnasal drip where you're trying to swallow, right? And it's because this fluid from your ear is draining into the back of your throat, to the Eustachian tube. So let's see that picture. Here we are, middle ear. We're in here, and let's say we get a lot of fluid because we got this terrible cold, and things are not looking good and there's fluid everywhere. Well, this can drain out like this, and it's going to go to nasopharynx, or to the throat. So postnasal drip is when you're swallowing, because the fluid in here keeps accumulating and dripping out down that way. An interesting side, see the angle of this? It can drip pretty easily. In kids, in young children, this is flatter. It's like this. And so that fluid stays there, and it stays, and it's warm, and it's perfect for bacteria, and kids will get horrible ear infections. And then this tympanic membrane starts to bulge out like this because there's so much pressure in here, and that is painful. So kids have a lot of painful earaches sometimes because of this flattened Eustachian tube. And as they grow, it'll grow to this angle, and it'll be able to drain. Okay, so remember the petrous portion? Well, that's where the inner ear is going to be. So we'd have to carve away at the petrous portion to be able to see what's going on in the middle ear. In the inner ear, excuse me, in the inner ear. What's going on in the inner ear? Well, we call it a bony labyrinth because it's a cavity within the bone. And it's divided into 3 separate areas that do very different things. So keep them really far apart in your mind. Inner ear is going to have vestibular apparatus, and that the vestibule in regular English, vestibule means the entryway, like the foyer is the vestibule. So it's that entry place, and it contains something called the utricle and the saccule that we're going to talk a lot more about. For now, let's leave it there. I'm telling you only that it's involved in equilibrium, and it also monitors the position of the head, so you know you're not walking crooked. You know that you're not walking tilted, right? Your head is upright, and that's because of your vestibular apparatus. This is a picture of that. So the vestibule is this middle part of this funny inner ear. So let me backtrack a few slides. If I showed you the inner ear here, it would have these loopies that are not called loopies, but we're going to call them that for now. And then it has the vestibule, right? The entryway. And then it has the cochlea. 3 parts, okay? Vestibule, semicircular canals, and the cochlea. Okay, so I am now going to stop this here, and then we're going to keep on looking with more detail at what happens in the vestibular apparatus. Thanks for listening. Bye.